This Excel spreadsheet is the data synthesis and analysis tool. It consolidates data across the schemes you have prioritized to summarize the status of purchasing in your country's health system. It can be tricky to collect data in Excel, and so we have extracted the data fields into Word documents to help you collect data for each scheme in greater depth. For more tips on data collection, see the next video in this series, the data collection tool. The Excel tool has been modified and improved based on application in more than 20 countries. The first worksheet is the introduction. From there, you can access the other worksheets in the tabs along the bottom. The next 4 worksheets are for data entry, while the last 2 worksheets are for data analysis. You can find the objectives of the Excel document, the table of contents, and helpful tips on the intro page. This page also features the framework. The Excel sheets are grounded within this framework, and we will be referring back to the graphic throughout the video. Countries can have many health financing schemes, so you will need to select the most important schemes to include in your study. The data in this worksheet are standard criteria to support the selection decision when you are planning and preparing for the assessment. You will name the schemes on this worksheet, and the Excel will automatically populate the schemes on each subsequent worksheet. Data collection begins with governance and external factors. The data in this worksheet helps you understand the laws, regulations, and rules, written and unwritten, that govern the schemes in general, and specifically how they pay providers. The governance and institutional arrangements questions will help you understand the different purchasers, that is, all the organizations involved in purchasing within each scheme and how they relate with each other. This will help you see the overlaps and duplication in function between the organizations. External factors are rules, laws, regulations that may be set outside the health sector but directly impact how purchasers can carry out their functions. Notice that some of the questions are shaded because they link to the benchmarks worksheet. The color coding will guide you to the data you need for the benchmark analysis. The third worksheet is about the 4 purchasing functions. The first function is benefits specification, which services and medicines are covered by each scheme. Are there quality standards, co-payments? Then contracting arrangements. How are providers and health facilities selected and contracted? Followed by provider payment. How are those providers and facilities being paid? Are there multiple payment systems? The last section, performance monitoring, is about how each purchaser monitors the performance of health service providers and uses the data to improve performance. Here again, questions are color-coded to link to the benchmarks. The fourth worksheet looks at each scheme's capacities in information technology and communications, which enable them to perform the purchasing functions effectively. So why does all of this matter? We are not only interested in what is happening in each scheme, but also how this is causing positive or negative consequences across the whole system. The result analysis captures data on how purchasers influence providers to deliver good quality care and be more responsive and accountable to the health system. The result analysis intends to capture data on what degree each scheme is able to allocate resources effectively, incentivize provider behavior, make providers accountable for quality. Next, to what degree are schemes contributing to the country's progress towards universal health coverage? Here, we are looking for data on outcome indicators for equity, efficiency, saver utilization, among others. Often, this type of data, outcome indicators, are available at the population or system level, not for each scheme. Once you have added the data available, you will step back and analyze this worksheet across the schemes to look at the health system level. Which UHC objectives and goals is there more progress? Where are the biggest gaps? How might purchasing be more strategic to accelerate progress? The beauty of this framework is that it allows us to look at the big picture and see how all these parts working together advance universal house coverage. The second to last tab presents evidence-based benchmarks for governance in the 4 purchasing functions. Each benchmark defines 3 levels of incremental progress, from passive to strategic purchasing. This is where we make the link between where we are and where we can improve based on published literature and normative guidance. To determine which of the 3 levels each scheme has achieved, you will go back to review the data responses to the color-coded questions in Worksheet 2, Governance, and 3, Purchasing Functions. We will go further in depth into the benchmark later in the toolkit. Strategic purchasing is evolving in its own technical vocabulary. A basic term like purchasing can be understood differently by different people. The glossary explains terminologies to be clear and precise about technical terms that you will use in this tool. Previous applications show that countries and even schemes within the same country will use different terms for the same thing, especially when translating from other languages. So, you will need to map the technical terms in this tool to the language used in your country. For example, purchasing is often confused with procurement, and so it is very important to be upfront that we are assessing those resources that flow to providers for health resources, and this may or may not include procurement of medicines. What does success look like? Once you have completed the tool, you will have a good understanding of purchasing and be able to engage your stakeholders better to craft options to address the gaps identified through this assessment.